Hi everyone, we are Risky Kid-ness. Meet Karina. She is a full-time child care worker caring for 10 toddlers, although Tina is her favorite. After 10 years in this role, Karina has become a bit complacent with how to correctly handle the children in a way that protects her body from injury. She has come to us complaining of lower back pain, which occurs during her shift and after work. Now let's all have a look at Karina at work and see where the problems lie. Did anyone notice anything that might be contributing to Karina's lower back pain? Great ideas. Here's what we thought. When Karina is bending down, she is flexing at her hips and trunk while keeping her knees locked. The strain placed on her lumbar spine is exacerbated by standing far away from the toddler and overreaching. By holding the toddler at an arm's length, the force required to lift the load has now been multiplied by 7 to 10 times. This also shifts her center of gravity anteriorly, which adds unnecessary strain on back extensors. While Karina is picking up the toddler, she has planted her feet and is already rotating her trunk towards the high chair and overreaching to place the toddler down. From what we have observed, these are the reasons Karina is likely experiencing lower back pain.
As Karina was picking up Tina to place her in the high chair, it was evident that she was flexing the spine, had a posterior pelvic tilt, and was holding the baby too far away from her body during lifting. This increases the shearing force placed on the intervertebral disc of the spine. Some possible pathologies that can arise from this poor lifting technique include the potential of a bulging or herniated disc and repetitive strain injury. A study by Dolan and Adams found that in repetitive lifting techniques, the more the action is repeated, the more measurably fatigued the erector spinae muscles become, and the greater the spine becomes flexed as a result. Karina rotated her body to place little Tina in the high chair rather than moving her feet to face the chair. Locking the knees whilst twisting the torso can put you at risk of the following pathologies: anterior cruciate ligament damage and meniscal wear and tear. Rotating the spine whilst lifting a heavy load puts extra strain on the spine. Prior to us altering Karina's movement, she was rotating her torso to place little Tina in the high chair. After we changed her feet placement, she was able to do this with 0 degrees of torso rotation, which reduced the strain on intervertebral discs and ligaments. When Karina was placing little Tina in the high chair, she was carrying her away from the body. This shifts Karina's center of gravity anteriorly, out of her base of support. To compensate for this heavy load, postural muscles are switched on to help maintain balance. Specifically, the back extensors, gastrocnemius, soleus, and hip extensors.
Now, we know Karina's lifting technique was suboptimal. In an ideal lifting technique, the person should flex the knees and have slight flexion at the hips while keeping the spine neutral. As you can see in the image on the left, flexing the knees activates the quadriceps muscles eccentrically, taking the pressure off the lumbar spine. Now let's have a look and see what we do to correct Karina's lifting technique. First, we get Karina to stand closer to the toddler. We then get Karina to spread her feet shoulder width apart. Next, we tell Karina to flex at the knees and extend the spine, reducing kyphosis. When Karina lifts the toddler, we advise her to bring the load close to her body. This moves the centre of gravity into the base of support. As well as the corrections in the video, we also advised Karina to move her feet to face the high chair when she's putting Tina in the chair. This will reduce any rotation through the spine. Rotating through the spine when holding a load increases forces on intervertebral discs and other passive structures like ligaments. The reason it's important to keep a neutral spine when lifting is that it encourages the normal lordosis in the lumbar region. We also corrected Karina's posterior pelvic tilt to help her keep this natural lordosis. When lifting with a neutral spine, the activity of the erector spinae muscles is increased to stabilise the trunk. Having a flexed spine creates bursts of activity in the erector spinae muscles, leading to pain, discomfort and strain on ligaments.
Along with having a flexed spine, holding the load outside of the base of support can further increase the strain placed on the active and passive structures of the spine. As mentioned before, holding the load at arm's reach away from the body can effectively increase the weight of the load by 7 to 10 times. This is simply because the load is further away from the moment arm and is generating more torque force. This will accelerate the rate of muscle fatigue that Karina is experiencing and increase the risk of injury. With this in mind, we advised Karina to keep the load close to her body, which will reduce the strain placed on her musculature and give her a greater capacity to perform this movement repetitively and without injury. To help Karina maintain this corrected lifting technique, we want to help strengthen and stretch certain muscles. Performing scapular squeezes will strengthen the trapezius and rhomboid muscles and will allow Karina to lift with retracted shoulders. To strengthen her spine, we advise she performs a 4-point kneel Superman, which will improve her back extensor strength and stability. Core stabilization is important in bracing and supporting the spine while lifting. To strengthen these abdominal muscles, we recommend a Pilates-style exercise such as supine dead bugs. Bodyweight squats will help to strengthen the quadriceps and glutes, as well as helping Karina to practice the movement pattern of her new lifting technique. Lastly, hamstring stretching will reduce tension on the pelvis and aid in reducing the posterior pelvic tilt. Looking at the comparison of Karina's lifting technique before and after our intervention, you can clearly see the major changes to her spine posture, knee flexion, hip flexion, and overreaching.
Bye, Karina. Here's to hoping your business is no longer risky.